Hello, it's Dr. Haddad, Chief of Staff at the hospital. Hope you're doing well. We are fairly busy actually at the hospital nowadays, which is a bit unusual given that it's August. Our bed occupancy is at 94%. Our medical units are above capacity at 114% bed occupancy. The good news is that we have zero active COVID cases at the hospital, while we still have very few patients who are recovering from COVID itself. We continue to prepare for the fall and winter season, which traditionally is the busier season, especially with the onslaught of more respiratory illnesses. We hope that a fourth wave of COVID is not as bad as the previous ones, but I'm certain that we will have more cases. Canada is doing very well to reduce or mitigate the risk or the peak of a fourth wave, given the fact that 80% of eligible people are vaccinated, mostly fully by this time. Nevertheless, I'm still a bit concerned about the fact that 20 to 25% of people between the ages of 40 and 70 haven't received any vaccine yet. That was the population we saw in our ICU in the third wave. So please do your best to go out there and get a vaccine. It takes 5 weeks to be fully vaccinated. Between first dose, wait 3-4 weeks, get a second dose, wait 2 more weeks to have immunity. So as our society opens, which is good, and schools are opening soon, which is good for our kids as well, the chance of all of us being exposed to COVID increases. The mitigating measures that we endured over the past 16 months, from shutdowns and less socialization, are being relaxed. So it's more of a reason to actually get protected with a vaccine. Vaccines don't stop us from being exposed to a virus. Vaccines are to protect us once we're exposed to a virus, and that will happen as we all mingle more. The effectiveness of the vaccines is really good even against Delta. There's been a lot of data and mixed messages out there. The vaccine is still showing 90% effectiveness against any hospitalization with Delta. So development of severe illness or hospitalization is being mitigated by the vaccine to great extent. 97% of admissions in the US due to COVID are among the unvaccinated, unfortunately. In the UK, even as their cases in the community were peaked at the same number as before the previous wave, their number of hospitalization was a fraction of hospitalization in previous waves, about 10%. That's because 87% of society was vaccinated. And more interestingly, even among that small percentage of bump in hospitalization, still most of them were unvaccinated, even though they only accounted for 13% of their population. So the goal of the vaccine is to decouple the virus from severity of illness. Even if you are vaccinated and get COVID, it'll become like a common cold. You'll get the sniffles for a couple of days and get better. That is the main goal of the vaccine: declaw the virus. Now, 60 to 88% of people who get vaccinated don't even get infected with Delta. The ones who are getting infected with Delta have a milder course, shorter course. So it's still holding up. And I have a feeling that even if we get worse variants in the future, the vaccines will adjust and be updated to cover those. We need to protect each other. We need to protect our kids who can't be vaccinated yet. So the best thing we can do for parents, teachers, adults, adolescents, all around the kids is to get vaccinated as well. We will do our best as a hospital to accommodate everyone, of course, but don't forget that we are in a finite resource system. We don't have unlimited beds or unlimited staff. So if we get swamped, then the care for everybody, regardless of vaccination status, will be affected if we have any surgical cancellations or no beds, etc. So we're all in this truly together, and all of us need to do our best to mitigate the risk of a fourth wave, whether it's the extent of it or the impact of it on our hospital, businesses, and schools. I'm hoping the opening is a one-way opening, but with that comes the responsibility of ensuring that this continues to be the case. Thank you so much. Stay safe. And if you have any questions, please feel free to reach out to your healthcare provider, public health unit, or the hospital. Thank you.